Hi class, we're going into week 5 this week and we have 2 assignments due. One is about a petite 65-year-old female with back pain, and petite and 65-year-old probably will give you a lot of clues right there as to what you can write about. And you'll be doing a focused assessment on mostly a neurological or a back orthopedic type of problem. The other assignment is a little bit different. You're going to create a case study, and you're going to use evidence-based practice to back up your treatment of this patient. I think here there's a couple different ways you can look at it, but I think one of the best ways you can look at it is if you look at your own practice this week, look at a few of your patients and their diagnoses, you can almost move backwards from that. You can look at core measures that your hospital or your facility uses and take those core measures and look back at the clients that you have and maybe use some of that evidence-based practice from core measures and how you're treating these particular patients. So there's a lot of work to be done, but I think if you approach it that way, it'll be a little easier for you. You start by using evidence and look back at a patient that maybe you've had this week, whether you work in an emergency room, an open heart unit, in a school, I think you can use that with anything. As always, if you do use a real client, please do not use anything identifying. You don't want a name, don't want an address. You can use initials. And it says based on a topic that we've addressed this week, or not this week, during this class, and the topic was health assessment. So anything that we've addressed at all, anything that we've talked about, any health assessment issues at all, you can use. So don't feel like you have to be that you have to use one of the hard of hearing patients or something like that we've used, that you've written papers on this last 4 weeks. So in the same of next week, when you do your final, I just want you to take all identifying information off of all of that information that you'll be writing up. It's about patients and patient care and how you would assess a patient, but we don't need anything identifying. I'm sure by next week we'll be APA perfect, or this week we should be pretty much APA perfect. I have had you relook at some papers for that. I know that you probably think I kind of stress that, but I do, because you need that with the rest of this class, and if you go on for your master's, you certainly are going to want to have that under your belt. It's just one more thing you won't have to worry about. Give me a call if you need anything. If you have any questions, please email me. That's about all I have to say for this week. If you need anything, call me. Thank you. Bye-bye.